up here in the neck and area. It's collecting blood from the head, from the upper extremity, going into the right atrium, and coming from the lower part of the body, collecting blood from the abdomen and the legs and everything below the diaphragm, is the inferior vena cava. Both of these dump into the right atrium. Okay? The right atrium has a valve here. Blood goes from the right atrium into the right ventricle. The right ventricle contracts and sends blood out through the pulmonary trunk, which sends blood to the left lung and blood to the right lung. After the blood goes to the lungs, picks up oxygen in the lungs, it comes back through two pulmonary veins on this side, two pulmonary veins on that side. They go into the left atrium, which is back on the back side of the heart. That empties blood into the left ventricle, and when the left ventricle contracts, the blood goes out to the ascending aorta, which sends branches to the right side of the body, to the head, to the left arm, and then all the way down into the abdomen and the legs and everything else down there. There's an endless number of these little slides. Okay, so the blue side, right, in the lungs, going to the lungs, is receiving deoxygenated blood from the body. Okay, the red side receives oxygenated blood from the lungs, which goes into the left atrium, down into the left ventricle, and out through the aorta. This is basically what I just told you before. Okay. Now, so there's names for these, not just the chambers, but the valves between them. So the blood comes into the right atrium from the superior and inferior vena cava. When the right atrium contracts, it forces blood through the right atrioventricular valve, called the tricuspid valve, because there are three flaps on it, into the right ventricle. The right ventricle contracts, sends blood through the pulmonary valve, which is at the top of the right ventricle, and then that goes up to the lungs on either side. Okay? Blood comes back from the lungs into the left atrium through the pulmonary veins. And when the left atrium contracts, it sends blood through this valve called the mitral valve, or the bicuspid valve, from the left atrium into the left ventricle. And you'll see this in this schematic, and you'll see in your section today, the left ventricle is a really big deal. It is incredibly thick. You'll cut open the right atrium and you'll say, oh, there's a lot of space there and there's fairly thin walls. You'll try to cut open the left atrium and you'll say, gee, there's not much space there, but there sure is a huge wall. Because this left atrium has to pump blood out through the aortic valve to the very tips of your fingers and tips of your toes. So this is a very, very thick muscular wall in this left ventricle. So blood from the left ventricle goes up through the aorta, and there's the arch of the aorta, which you'll see tomorrow, which sends blood to the right side of the body, and then up to the head, and then to the left arm, and then goes down the aorta all the way down into the abdomen and legs. Okay. Just a clinical note, because people have valve problems, and valve problems have traditionally been an issue of concern for dentists. So prior to 2007, dental patients with a mitral valve problem were prescribed lots of antibiotics before they were treated, because there's always the worry that in scraping off or cleaning their teeth, you might introduce some bacteria into the bloodstream, which will end up in the heart. Apparently that is no longer the case. So apparently that is no longer the case. I'm sure you will learn this in your later years, but just to note, this is something that's sort of relevant to anatomy. They don't no longer recommend that when someone comes in, you automatically pump them up with antibiotics. But there are other heart problems that have to be dealt with in advance. Okay, development. You will see some structures in the course of your dissection that are just there. They have names, but they don't seem to be doing anything. And that's because the circulation in the uterus, when the fetus is in the uterus, is very different from the circulation once you're born. The main problem being, once you're born, you have lungs, and there's a world out there of air for you to breathe. When you're in the uterus, there's no air for you to breathe. So there's absolutely no reason to have your lungs inflated because there's no air to breathe. You probably don't want to breathe in, the fluids that are there in the uterus. So the circulation to and from the lungs has been bypassed. Okay? You're going to see this in both sets of slides. Okay. So what happens? The blood coming from the rest of the body comes in the superior vena cava and the inferior vena cava into the right atrium. Should go down to the right ventricle in an adult, and then it goes out the right ventricle, up the right ventricle, into the pulmonary trunk, and goes to the right and left lungs. Well, if your right and left lungs aren't working, there's absolutely no reason to send that blood there. So what happens is there is an opening between the right and left atria that shuttles the blood from the right atrium straight into the left atrium, and it gets pumped around to the rest of the body. It doesn't go to up to the pulmonary trunk. It doesn't go to the lungs. Okay? Likewise, the blood, in case some slips by, because these things are not, the blood coming up the pulmonary trunk that in the adult goes to the lungs to pick up oxygen. The lungs don't have any oxygen before you're born. The lungs are largely collapsed. There's no oxygen there, anything. So there's an opening between the top of the pulmonary trunk and the aorta. So this blood goes straight into the aorta and avoids going to the lungs. So there are two ways in which you try to keep blood away from the lungs. First, you shuttle it between the atria so it doesn't even bother to go into the right ventricle. And then any that actually gets in there and goes up to the pulmonary trunk, you shuttle it directly into the aorta. Because it's just, aside from keeping a little bit of blood in the lungs so that they develop, there's no reason to send oxygen there because it's not getting its blood supply from there. The oxygen in the blood of a fetus, it comes from the mom's blood. So you will see what was this foramen ovale, and when it doesn't work anymore, it's called the fossa ovalis. You'll see that between the two atria. And if you sort of pick around between the pulmonary trunk and the arch of the aorta, you'll find what was a connection between those two. It was the ductus arteriosus, but when it's closed up, it's called the ligamentum arteriosus. Okay, so that's basically what I told you. There are two ways to avoid blood going into the lungs. First, there's this fossa ovalis, foramen ovale, that sends blood from the right atrium to the left atrium, so it just goes back in normal circulation. And second, anything that ends up in the pulmonary trunk can take a shortcut into the aorta through the ductus arteriosus. And this is just, once again, this shows, this is the shunt here between the pulmonary trunk, which is going to the lungs, going into the aorta. Okay, so, and once again, what actually happens is there is a hole there, but it's like many valves in the heart. What you really have is you have just a flap of tissue and a flap on this side, so that when there's no pressure in one side, it can be open, but when there's pressure on both sides, they cover them up. So when you dig through the valves of the heart, you may find that there actually is an opening between the right and left atria, but normally once there's blood on the ventricular side, on the left side, those valves will be closed. So that you can sometimes stick a probe between the atria, but it doesn't actually have any function. When that does not close, that's what, they're usually called blue babies, right? Because the blood is not going to the lungs. It's going straight from the right atrium into the left atrium, and then being pumped around to the body without picking up oxygen from the lungs. So that the infants that are born with that open foramen ovale have a blue cast because they don't have as much oxygenated blood there. The blood skipping the lungs, which is a good deal when you're a fetus, not a good deal when you're a newborn. Yes, sir?
So this is only during fetal development?
Yes. Yeah. Once you're born, remember, you see all these movies, right? Once you're born, they smack the baby on the butt and it goes, ah! And suddenly the lungs are working perfectly, in theory. I'm sorry?
Is it possible for the fossa ovalis to stay open when you're an adult?
Yes. Yes. As I said, when it doesn't close properly, in particular, it hasn't closed when someone's born. The babies have a blue tinge to them because the blood's going from the deoxygenated blood's coming into the right atrium, going into the left atrium and being pumped around the body and missing the lungs, so they don't get the oxygen going in, as much oxygen going into their blood as they should. They're called blue babies. And they sometimes this takes care of itself. They're a little bit slow, but sometimes they have to go in and do an operation, close off that opening. It's not, I won't say it's not uncommon. I mean, many people have relatives or know of people who have had to have that part fixed in their heart. Yes?
So where does the gas exchange occur?
In the lungs, in the alveoli of the lungs.
But I thought we're bypassing the
Oh, in babies?
Yeah.
The blood that comes into the fetus through the placenta is the mom's blood, and that's where the mom's blood has oxygen that's passed on to the baby's blood.
So once it goes into the right atrium, it's already oxygenated?
Yes. All the blood that comes into the body comes from the mom, and she's got oxygenated blood because she's got lungs working. But the baby's lungs don't work. They're not exposed to the air, so there's no reason in sending your blood there. They're totally dependent upon the oxygen in the mom's bloodstream. And this is what happens when that is open, okay? Because if that is, as you're saying, if that opening remains there, some of the blood coming from the right atrium gets into the left ventricle and gets circulated to the body, but it doesn't have much oxygen, so the body's getting a bad deal. Okay, now I've got to try to figure out how to go to the one that shows some a little more realistic stuff. Okay, let me see here. Da, da, da.
The other mediastinum information, is that at the very end of the lecture, like the last two slides we went over? Friday.
Yes, but I will go into that in more detail tomorrow because that's
Okay.
when you're dissecting.
Okay, cool.
It was in this lecture, but we're not going to get there because I think you should go through the heart. I'm trying to get these things more lined up instead of giving you both the superior and posterior mediastinum today, and then you get around to dissecting it tomorrow. I've cut that part out and thrown it into tomorrow.
Mm-hmm. Okay.
To try to make these things a little bit better. Okay, this should work. Okay, so here's more about the heart. There's a little bit of review, but there's more about coronary arteries, blood supply to the heart, and pictures of what the ventricles and atria look like. A little bit more discussion of the valve, and a discussion of innervation and referred pain. You've seen this slide before. Again, middle mediastinum is what we're talking about today. Sternal angle. Again, the pericardium. When you open up your body, this is sort of what you've already opened up the body. This is the area you're going to concentrate on. Okay? This pericardium coming down here, you'll see there are some vessels going into it. One structure you will also pick up is the phrenic nerve, which you'll remember is a nerve from C3, C4, and C5 going to keep the diaphragm alive. The phrenic nerve runs right across this pericardium. So when you're sort of opening up the pericardium to get to the heart, make sure you realize that there's a phrenic nerve running over it. Don't just say throw it away because it's just stuff. Again, the same thing I talked about before. There's the two serous layers, the visceral pericardium around the heart, and the parietal pericardium, which is referred to as the serous pericardium. And then there's a fibrous layer on the outside. Okay. Again, when you look at the heart, when you cut through the the pericardium, the fibrous and the parietal layer, this is what the heart itself looks like. Okay? And you'll notice there are some veins running down these grooves. Okay? And these grooves, which basically separate the chambers of the heart, also is where the coronary arteries, the arteries that are supplying blood to the heart tissue itself, are lying. So this groove over here, number A, which wraps all the way around the heart, is separating the right and left atrium from the right and left ventricles. Okay? So that's referred to as the atrioventricular sulcus. Okay? Then there's another groove, which you see running over here on the left side of the heart, which wraps around like that, and that separates the right ventricle from the left ventricle. So that's referred to as the interventricular sulcus. Okay? And you will see these in the heart. And as I said, running in those grooves are the arteries that are supplying the blood, the heart itself. This is, it seems sort of odd, doesn't it? So here you've got this heart, which has got all the blood in the body pumping through it numerous times in the course of a minute, but it has to get its own blood. So it has its own arteries. It's not just living off of the blood that's going through the inside of it. Okay? So going down this sulcus here, this atrioventricular sulcus, is the right coronary artery, and coming down here is your left coronary artery. We'll see these in greater detail. Okay, so here's a less schematic view. Okay, so again, here's the superior vena cava, inferior vena cava going into the right atrium, the tricuspid valve going from the right atrium to the right ventricle, the pulmonary valve coming up here, separating the right ventricle